Hi, my name is Julia, and I am a third-year medical student rotating with Dr. Ben-Zur. This is part 2 of second-degree AV blocks. In this patient, we have a 85-year-old female with recent onset of chest pain. First thing you want to do when you look at an EKG is estimate the rate, and so I'll be doing that using the concept of this strip being a 10-second strip. And counting my P waves, I see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, about 13 P waves. So that times 6 would be about 78 beats per minute. Next thing I want to do is figure out if there is a P wave for every QRS, or if I can just figure out whether this rate or this rhythm is sinus. And I do see that the P waves are coming at regular intervals, and so I can say that this is a sinus rhythm, although there is not a QRS for every P wave. Next thing I want to be doing in this EKG is seeing whether or not the PR intervals are elongating, and the reason I am thinking in that direction is because I see these dropped beats in between. And the difference between a type 1 mobits and a type 2 mobits is that type 1 has an elongating P wave or PR interval where it's short, medium, long, or as long as you see it elongating and then a dropped beat. Whereas in type 2 mobits, you don't have a warning where the PR interval elongates. All the PR intervals are roughly about the same length. So let's start here. The PR interval here is about 1, 2, 3 small boxes. Here is about 1, 2, 3 small boxes as well. And like we did on the other EKG, let's go all the way through. PR interval here is about 1, 2, 3 small boxes. Here is about 1, 2, 3 small boxes as well. So I don't see a PR elongation, and so I'm thinking that it is type 2, or mobits type 2. In order to figure out the ratio of dropped beats, we can look at how many P waves there are for every QRS. And if we look at this first set here, we see 3 P waves, 1, 2, 3 for every 2 ventricular contractions. If we look at this second set here, we see 1, 2, 3 P waves for every 2 ventricular contractions. If we look here, the ratio is slightly altered, but the majority is going to be 1, 2, 3 P waves for every 2 ventricular contractions. So we can say that this is a 3 to 2 second degree mobits type 2 block, AV block. One last thing I want to bring to your attention is this down here in V1, V2, V3, and V4. So that would be your anterior septal wall precordial leads. This is a elongated Q, and therefore it's indicative of possibly an old MI. And so this patient probably has an old infarct in the anterior septal wall, as well as a 3 to 2 type 2 mobits type 2 second degree AV block. Thanks for watching.